Welcome back, everyone. Botox isn't just used for wrinkles. It's also used to treat an embarrassing problem, which would be excessive sweating. Dr. Sherry Ingraham with Advanced Dermatology joins us this morning to show it how it works. Good morning to you.
Good morning.
Glad you're here because I don't think a lot of people know about this.
Yeah, you know, hyperhidrosis can be such an incapacitating condition. It can really cause embarrassment. It can cause concern in the patient that others are noticing it, even when the patient is the only one noticing it, which can make it difficult for them to have interpersonal relationships and also even work in some instances.
Because what happens, even if you wear deodorant or antiperspirant, it can still soak through the clothes, and for a female, that can be very difficult to deal with.
For women and men, you know, typically a sweat spot under the arm and the axilla should be about 5 centimeters. When it goes beyond this area, we're talking about hyperhidrosis. Also, if you're sweating through your clothes, the clothes are getting stained, they're getting discolored, and also we can't discount the import of hyperhidrosis on the hands and feet. People who often have axillary hyperhidrosis have it on their hands and feet as well, and they can't take certain jobs like cooking, for example, or drawing where their hands get slippery.
Well, you brought in your patient, Shayna. Good morning to you.
Good morning.
You are so lovely, and you've actually had this done before, so you know what to expect. And we're going to, you've got some, I guess, is it an ice pack right now?
Yeah, this is a little ice pack. So Shayna had a little bit of numbing this morning as well, just a little topical numbing. Some patients need that, some don't want it, and they say that this actually isn't as tender of an injection as doing it in the face, for example, on some
And just so you know at home, everybody, we're going to cover it up a little bit so you don't actually have to watch the needle going in, so you can breathe a sigh of relief there. But Shayna, tell me what that feels like, because again, the needle is very short and it's very thin. So what does it feel like to you right now after being numbed?
It's pretty comfortable. You don't feel the initial stick. If you've ever been bit by a mosquito bite, it's comparable to that. It's very tolerable.
So just little bitty tiny mosquito bites.
Yeah, and by the time the doctor is usually talking to you, you know, you're pretty comfortable between the ice and the numbing. It's before you know it, you're done.
And then what about the results? So you've had it done before, so before would your shirt or whatever you were wearing get pretty damp?
Oh yeah, I used to base my wardrobe purely on sweating, so it was always black, it was tank tops, racer backs, because I didn't want to show sweating. Now I can wear whatever I want.
What a relief that's got to be. That is huge. How in the world did somebody figure this out, Dr. Ingraham? What an interesting result to get from this.
You know, what they realized is, I'm going to give you a little ice now, what they realized is that Botox, remember, blocks the transmission from the nerve to the muscle, which causes the muscle to move, which is why when we use it in the face, you decrease muscular movement. Well, it also decreases the movement of the little muscles that innervate the eccrine glands or the sweat glands under our arms. So basically, those sweat glands don't get any more stimulation from the nerves and you stop sweating. And so a typical patient will results last about 6 to 12 months, on average about 7 to 9 months. You're really getting 7 to 9 sweat-free months, I tell patients. There are other alternatives for patients available with hyperhidrosis, but this is a really nice one that gives you months of a sweat-free period without systemic complications. Some of the oral medicines we give for hyperhidrosis, like Robenol, which is glycopyrrolate, it can have some untoward side effects if taken. Have you ever taken that pill? It can have side effects like dry mouth and some other side effects patients don't like. Also, we do this treatment often in the hands and feet. That is a little bit more uncomfortable for patients, but talk about changing someone's life.
Oh, it's huge, because I have met people before who were embarrassed to shake hands because they apologize and they wipe it off, and it really helps if you're in the business world and have to shake hands a lot. Let's talk about price real quick.
Right. So an average price would probably be in the range of $1,200 to $1,400 to do both armpits. And again, you're looking for results that last on average about 9 months, in many cases up to a year.
All right, Dr. Ingraham, thank you for being here. Shayna, thanks for being such a good sport and opening the eyes to a lot of people who probably have the same situation. Hope it keeps working really well for you.
Thank you.